a WikiVidi documentaries production. Don't forget to like and subscribe. Enjoy. Nicotine. Nicotine is a potent parasympathomimetic stimulant and an alkaloid found in the nightshade family of plants. Nicotine acts as an agonist at most nicotinic acetylcholine receptors, except at two nicotinic receptor subunits where it acts as a receptor antagonist. Nicotine is found in the leaves of Nicotiana rustica, in concentrations of 2–14%, in the tobacco plant, Nicotiana tabacum, in Duboisia hopwoodii, and in Asclepias syriaca. Nicotine constitutes approximately 0.63% of the dry weight of tobacco. It also occurs in edible plants, such as those in the family Solanaceae, which include eggplants, potatoes, and tomatoes for example, but at trace levels generally under 200 nanograms per gram, dry weight. Nicotine functions as an antiherbivore chemical. Consequently, nicotine was widely used as an insecticide in the past, and neonicotinoids, such as imidacloprid, are widely used. Nicotine is highly addictive. An average cigarette yields about 2 mg of absorbed nicotine. In lesser doses of that order, the substance acts as a stimulant in mammals, while high amounts can be harmful. Nicotine addiction and dependence involves drug-reinforced behavior, compulsive use, relapse after abstinence, physical dependence, psychological dependence, and drug tolerance. Beyond addiction, both short and long-term nicotine exposure have not been established as dangerous to adults, except among certain vulnerable groups. At sufficiently high doses, nicotine is associated with poisonings and is potentially lethal. Nicotine as a tool for quitting smoking has a good safety history. There is inadequate research to show that nicotine itself is associated with cancer in humans. Nicotine in the form of nicotine replacement products poses less of a cancer risk than smoking. Nicotine is linked to possible birth defects. If exposed to nicotine during pregnancy, a child may have an increased risk later in life of type 2 diabetes, obesity, hypertension, neurobehavioral defects, respiratory dysfunction, and infertility. The use of electronic cigarettes, which are designed to be refilled with nicotine-containing e-liquid, has raised concerns over nicotine overdoses, especially with regard to the possibility of young children ingesting the liquids. Psychoactive effects. Nicotine's mood-altering effects are different by report. In particular, it is both a stimulant and a relaxant, first causing a release of glucose from the liver and epinephrine from the adrenal medulla. It causes stimulation. Users report feelings of relaxation, sharpness, calmness, and alertness. When a cigarette is smoked, nicotine-rich blood passes from the lungs to the brain within 7 seconds and immediately stimulates nicotinic acetylcholine receptors. This indirectly promotes the release of many chemical messengers such as acetylcholine, norepinephrine, epinephrine, arginine, vasopressin, serotonin, dopamine, and beta-endorphin in parts of the brain. Nicotine also extends the duration of positive effects of dopamine and increases the sensitivity of the brain's reward system to rewarding stimuli. Most cigarettes contain 1–3 mg of inhalable nicotine. Studies suggest that when smokers wish to achieve a stimulating effect, they take short, quick puffs, which produce a low level of blood nicotine. Nicotine is unusual in comparison to most drugs, as its profile changes from stimulant to sedative with increasing dosages, a phenomenon known as Nesbit's paradox, after the doctor who first described it in 1969. At very high doses it dampens neuronal activity. Medical. The primary therapeutic use of nicotine is in treating nicotine dependence in order to eliminate smoking with the damage it does to health. Controlled levels of nicotine are given to patients through gums, dermal patches, lozenges, electronic/substitute cigarettes or nasal sprays in an effort to wean them off their dependence. Studies have found that these therapies increase the chance of success of quitting by 50 to 70%, though reductions in the population as a whole have not been demonstrated. Enhancing performance. Nicotine is frequently used for its performance-enhancing effects on cognition, alertness, and focus. A meta-analysis of 41 double-blind, placebo-controlled studies concluded that nicotine or smoking had significant positive effects on aspects of fine motor abilities, alerting and orienting attention, and episodic and working memory. A 2015 review noted that stimulation of the alpha-4 beta-2 nicotinic receptor is responsible for certain improvements in attentional performance. Among the nicotinic receptor subtypes, nicotine has the highest binding affinity at the alpha-4 beta-2 receptor, which is also the biological target that mediates nicotine's addictive properties. Nicotine has potential beneficial effects, but it also has paradoxical effects, which may be due to its inverted U-shape or pharmacokinetic features. Adverse effects. Limited data exists on the health effects of long-term use of pure nicotine, because nicotine is usually consumed via tobacco products. The long-term use of nicotine in the form of snus incurs a slight risk of cardiovascular disease compared to tobacco smoking. Nicotine is one of the most rigorously studied drugs. The complex effects of nicotine are not entirely understood. Studies of continued use of nicotine replacement products in those who have stopped smoking found no adverse effects from months to several years, and that people with cardiovascular disease were able to tolerate them for 12 weeks. The general medical position is that nicotine itself poses few health risks, except among certain vulnerable groups. A 2016 Royal College of Physicians report found nicotine alone in the doses used by smokers represents little if any hazard to the user. A 2014 American Heart Association policy statement found that some health concerns relate to nicotine. Experimental research suggests that adolescent nicotine use may harm brain development. Children exposed to nicotine may have a number of lifelong health issues. Administration of nicotine to guinea pigs has been shown to cause harm to cells of the inner ear. As medicine, nicotine is used to help with quitting smoking and has good safety in this form. Metabolism and body weight. By reducing the appetite and raising the metabolism, some smokers may lose weight as a consequence. By increasing metabolic rate and inhibiting the usual compensatory increase in appetite, the body weight of smokers is lower on average than that of non-smokers. When smokers quit, they gain on average 5-6 kilograms weight, returning to the average weight of non-smokers. Vascular system. A 2014 review found that nicotine use is not a significant cause of cardiovascular disease. A 2015 review found that nicotine is associated with cardiovascular disease. A 2016 review suggests that the risks of nicotine without tobacco combustion products are low compared to cigarette smoking, but are still of concern in people with cardiovascular disease. Some studies in people show the possibility that nicotine contributes to acute cardiovascular events in smokers with established cardiovascular disease, and induces pharmacologic effects that might contribute to increased atherosclerosis. Prolonged nicotine use seems not to increase atherosclerosis. Brief nicotine use, such as nicotine medicine, seems to incur a slight cardiovascular risk, even to people with established cardiovascular disease. A 2015 review found nicotine in vitro and in animal models can inhibit apoptosis and enhance angiogenesis, effects that raise concerns about the role of nicotine in promoting the acceleration of atherosclerotic disease. A 2012 Cochrane review found no evidence of an increased risk of cardiovascular disease with nicotine replacement products. A 1996 randomized controlled trial using nicotine patches found that serious adverse events were not more frequent among smokers with cardiovascular disease. A meta-analysis shows that snus consumption, which delivers nicotine at a dose equivalent to that of cigarettes, is not associated with heart attacks. Hence, it is not nicotine. But tobacco smokes other components which seem to be implicated in ischemic heart disease. Nicotine increases heart rate and blood pressure and induces abnormal heart rhythms. Nicotine can also induce potentially atherogenic genes in human coronary artery endothelial cells. Microvascular injury can result through its action on nicotinic acetylcholine receptors. Nicotine does not adversely affect serum cholesterol levels, but a 2015 review found it may elevate serum cholesterol levels. Many quitting smoking studies using nicotine medicines report lowered dyslipidemia with considerable benefit in HDL/LDL ratios. Nicotine supports clot formation and aids in plaque formation by enhancing vascular smooth muscle. Cancer. Although there is insufficient evidence to classify nicotine as a carcinogen, there is an ongoing debate about whether it functions as a tumor promoter. In vitro studies have associated it with cancer, but carcinogenicity has not been demonstrated in vivo. There is inadequate research to demonstrate that nicotine is associated with cancer in humans, but there is evidence indicating possible oral, esophageal, or pancreatic cancer risks. Nicotine in the form of nicotine replacement products is less of a cancer risk than smoking. Nicotine replacement products have not been shown to be associated with cancer in the real world. While no epidemiological evidence directly supports the notion that nicotine acts as a carcinogen in the formation of human cancer, research has identified nicotine's indirect involvement in cancer formation in animal models and cell cultures. Nicotine increases cholinergic signaling and adrenergic signaling in the case of colon cancer, thereby impeding apoptosis, promoting tumor growth, and activating growth factors and cellular mitogenic factors such as 5-lipoxygenase and epidermal growth factor. Nicotine also promotes cancer growth by stimulating angiogenesis and neovascularization. In one study, nicotine administered to mice with tumors caused increases in tumor size, metastasis, and tumor recurrence. N-nitrosoninicotine, classified by the International Agency for Research on Cancer as a Group 1 carcinogen, has been shown to form in vitro from nornicotine in human saliva, indicating nornicotine is a carcinogen precursor. The IARC has not evaluated pure nicotine or assigned it to an official carcinogenic classification. In cancer cells, nicotine promotes the epithelial mesenchymal transition, which makes the cancer cells more resistant to drugs that treat cancer. Fetal development. In pregnancy, a 2013 review noted that nicotine is only one of more than 4,000 compounds to which the fetus is exposed through maternal smoking. Of these, 30 compounds have been associated with adverse health outcomes. Although the exact mechanisms by which nicotine produces adverse fetal effects are unknown, it is likely that hypoxia, undernourishment of the fetus, and direct vasoconstrictor effects on the placental and umbilical vessels all play a role. Nicotine also has been shown to have significant deleterious effects on brain development, including alterations in brain metabolism and neurotransmitter systems, and abnormal brain development. It also notes that abnormalities of newborn neurobehavior, including impaired orientation and autonomic regulation and abnormalities of muscle tone, have been identified in a number of prenatal nicotine exposure studies, and that there is weak data associating fetal nicotine exposure with newborn facial clefts, and that there is no good evidence for newborns suffering nicotine withdrawal from fetal exposure to nicotine. Effective April 1, 1990. The Office of Environmental Health Hazard Assessment of the California Environmental Protection Agency added nicotine to the list of chemicals known to cause developmental toxicity. Nicotine is not safe to use in any amount during pregnancy. Questions exist regarding nicotine use during pregnancy and their potential consequences on fetal growth and mortality. Nicotine negatively affects pregnancy outcomes and fetal brain development. Risks to the child later in life via nicotine exposure during pregnancy include type 2 diabetes, obesity, hypertension, neurobehavioral defects, respiratory dysfunction, and infertility. Nicotine crosses the placenta and is found in the breast milk of mothers who smoke as well as mothers who inhale passive smoke. Reinforcement disorders. Nicotine dependence involves aspects of both psychological dependence and physical dependence, since discontinuation of extended use has been shown to produce both affective and somatic withdrawal symptoms. Withdrawal symptoms peak in the first day or two and can persist for several weeks. Nicotine has clinically significant cognitive enhancing effects at low doses, particularly in fine motor skills, attention, and memory. These beneficial cognitive effects may play a role in the maintenance of tobacco dependence. Nicotine is highly addictive, comparable to heroin or cocaine. Nicotine activates the mesolimbic pathway and induces long-term delta phosphate expression in the nucleus accumbens when inhaled or injected at sufficiently high doses, but not necessarily when ingested. Consequently, repeated daily exposure to nicotine can result in accumbal delta phosphate overexpression, in turn causing nicotine addiction. Independent smokers, smoking during withdrawal returns cognitive abilities to pre-withdrawal levels. But chronic use may not offer cognitive benefits over not smoking. Use of other drugs. In animals, it is relatively simple to determine if consumption of a certain drug increases the later attraction of another drug. In humans, where such direct experiments are not possible, longitudinal studies can show if the probability of a substance use is related to the earlier use of other substances. In mice, nicotine increased the probability of later consumption of cocaine, and the experiments permitted concrete conclusions on the underlying molecular biological alteration in the brain. The biological changes in mice correspond to the epidemiological observations in humans that nicotine consumption is coupled to an increased probability of later use of cannabis and cocaine. In rats, cannabis consumption earlier in life increased the later self-administration of nicotine. A study of drug use of 14,577 U.S. 12th graders showed that alcohol consumption was associated with an increased probability of later use of tobacco, cannabis, and illegal drugs. Overdose. Nicotine is regarded as a potentially lethal poison. The of nicotine is 50 mg/kg for rats and 3 mg/kg for mice. 30–60 mg can be a lethal dosage for adult humans. However, the widely used human LD50 estimate of 0.51.0 mg/kg was questioned in a 2013 review, in light of several documented cases of humans surviving much higher doses. The 2013 review suggests that the lower limit causing fatal outcomes is 501,000 mg of ingested nicotine, corresponding to 6.513 mg/kg orally. Nevertheless, nicotine has a relatively high toxicity in comparison to many other alkaloids such as caffeine, which has an LD50 of 127 mg/kg when administered to mice. At high enough doses, it is associated with nicotine poisoning. Today, nicotine is less commonly used in agricultural insecticides, which was a main source of poisoning. More recent cases of poisoning typically appear to be in the form of green tobacco sickness, or due to accidental ingestion of tobacco or tobacco products or ingestion of nicotine-containing plants. People who harvest or cultivate tobacco may experience green tobacco sickness, a type of nicotine poisoning caused by dermal exposure to wet tobacco leaves. This occurs most commonly in young, inexperienced tobacco harvesters who do not consume tobacco. People can be exposed to nicotine in the workplace by breathing it in, skin absorption, swallowing it, or eye contact. The Occupational Safety and Health Administration has set the legal limit for nicotine exposure in the workplace as 0.5 mg/m3 skin exposure over an 8-hour workday. The U.S. National Institute for Occupational Safety and Health has set a recommended exposure limit of 0.5 mg/m3 skin exposure over an 8-hour workday. At environmental levels of 5 mg/m3, nicotine is immediately dangerous to life and health. It is unlikely that a person would overdose on nicotine through smoking alone. The U.S. Food and Drug Administration stated in 2013 that there are no significant safety concerns associated with using more than one OTC NRT at the same time, or using an OTC NRT at the same time as another nicotine-containing product, including a cigarette. The rise in the use of electronic cigarettes, many forms of which are designed to be refilled with nicotine-containing e-liquid supplied in small plastic bottles, has raised concerns over nicotine overdoses. especially in the possibility of young children ingesting the liquids. A 2015 Public Health England report noted an unconfirmed newspaper report of a fatal poisoning of a 2-year-old child, and 2 published case reports of children of similar age who had recovered after ingesting e-liquid and vomiting. They also noted case reports of suicides by nicotine, where adults drank liquid containing up to 1,500 milligrams of nicotine. They recovered, but an ingestion apparently of about 10,000 milligrams was fatal, as was an injection. They commented that serious nicotine poisoning seems normally prevented by the fact that relatively low doses of nicotine cause nausea and vomiting, which stops users from further intake. Brought to you by WikiVidi documentaries. Would you like to know more?